Well, this is our work. Basically, we try to examine the transmission of coronavirus and do a series of predictive analytics from the perspective of contents and the auditors, which is a little bit different from what Wenru and Xinxin had done. We would like to apply the accounting framework, continuous monitoring system, and AI algorithms and models to an epidemic model. More specifically, we'll talk about the framework of our proposal. The first step is to establish a timely updated database for related topic. The data will include two parts. The first part is the endogenous data, which will include the data issued by official authorities like CDC. Another part of data is exogenous data. We are considering include data such like the Google Food Train Fever database and seasonal trends, thermometer reading apps. We hope with the combination of this exogenous data, our predictive model can be more accurate. After connecting the data, we'll try to establish the model. We basically will use a wide range of machine learning algorithms and epidemic models to do a series of predictive analytics of target-dependent variables. The target-dependent variables will include the confirmed cases and the test cases. Um, Sorry, this is my presentation today. then, then we'll try to identify the potential correlation between the confirmed cases, fatalities, and a series of economic indicators. The economic indicators will include the unemployment insurance claims, which is mentioned by Wenru, and we are also considering include the factors like the stock volatility in specific industries like catering, business, tourism, entertainment, retail, which are heavily affected by the outbreak of this epidemic. Okay, now we have established the model. Then we'll try to follow the framework of continuous monitoring system, and we'll perform a risk assessment based on the results produced by AI and epidemic models. We'll try to establish an alert system based on different thresholds following the risk assessment. What's the point? The point is that the alert will be generated if the predicted value reaches the threshold, which means that significantly risky consequence will happen in the future. As you can see, this is actually the insights of the continuous monitoring system, and perhaps this is the most unique point of our proposal. We try to understand and try to predict the transmission of coronavirus from the perspective of Khan and the auditors. And finally, we will build a recommendation system. If the alert is triggered, we several preventive policies and strategies in the pandemic and economic fields can be automatically recommended. By the way, with the help of a set of simulations, we can actually identify the optimal quarantine policy when confronted with the trade-off between the social interventions and the resulting negative impacts on the economy. Well, I would like to show you several graphs about our work. Right now, we are trying to use a very simple epidemic model called SIR to predict the US confirmed cases, and we try to predict the inflection point. We hope after predicting the inflection points and the estimating maximum confirmed cases, and also this curve, we can find out the correlation between the confirmed cases and the several economic factors like the unemployment insurance claims and stock volatility in specific industries as I mentioned in the framework. And this graph, in this
Sorry
graph,
to interrupt.
okay.
Sorry to interrupt. Can I ask how does the SIR model work?
Yes. The SIR model is a very simple epidemic model. It assumes that there are three parts of population. The first part of population is the susceptible people. The second part is infected people, and the final part is recovered people. The population will consist of these three kinds of people, and there are different transmission rate between these three parts of people. So as you can see, by using a series of differential equations and the initialized values for the susceptible people, infected people, and the recovered people, we can do this kind of prediction. This is a very, very simple understanding. Hope that makes sense.
Okay, thank you.
Based on the SIR model and assuming the total population is equal to 1,000, we can actually simulating the effects of different social distance policies on infected cases, assuming the total number of population is equal to 1,000. Um, as you can see in this graph, with different degrees of the infection probability, if we increase the exposures every day, you can see that the curve will really sharp. And if we do the social distancing, we can see that the curve can be really flat. And this graph also reflects the same truth. This is our current work and framework. Thank you.
Thanks.
Some neural network short memory to predict the outbreak of this epidemic. Thank you.
Thank you, Han-Chin. Thank you. This very interesting work. And if you kind of join A and B, meaning the one that Wen-Wu was talking and what Han-Chin is talking, first, Wen-Wu basically calls our attention that things are very complex. And then the second one, I'm trying to kind of share my screen here. And then Han-Chin actually joined or mixed up into the SIR model and tried to do some more traditional predictions, however, more like we have been modeling today. I kind of wonder if you noticed that President Trump talked about 2 million people dying in the US. Then he reduced it to 1 million. Then he used the University of Washington prediction for between 100 and 200,000, and now they are up to 60,000, down to 60,000 or 64,000, and etc., showing the huge range and whole need of better modeling and better understanding of these phenomena. I think in the whole story of what's happening, we need to start thinking about the economics of the story. This is very painful. What do you guys think?
Hello?
Come on, courage.
Yes. Hi. So, I mean, I think there's a tipping point. I mean, it sounds as sad as it sounds. And of course, when we have a little bit more of an information as to what is the real percentage of death that comes from this pandemic, and compare that with statistics as to what's happening when the economy is in such a dire condition, there is a tipping point, and there is that time that you need to start balancing, I think, easing up things so that the economy can work And I think it's something that it was mentioned that recession can kill more people at some point if it gets at that level, that it takes away resources from places that are really needed. And it is sad, but I do think it is true. There is a point. There is a point that needs to be balanced. That's my opinion.
I want to make one comment in the Wenwu and Shinshin paper. They do talk about this being a worse tragedy than the towers being attacked, or starting to compare with the Second World War number of deaths. They are difficult things to compare, but there is this economic factor. President Trump is basically kind of negotiating this in the sense of when do we reopen the country? And I don't think he has models that kind of do a trade-off of this thing. And certainly if he has it, he's not going to talk about it on TV. But his approach has been in the last couple of weeks, always, let's try to reopen the country. Actually, yes, he was talking about, yes, on Sunday, Easter Sunday, the country is starting to reopen. And now basically what they're talking is about kind of slow reopening in key areas, and monitoring the best they can with this horrible testing project method that they have, and lack of coordination and heterogeneous measurements. That's what the trade-offs he's talking about. To finish up, I brought in some of the things we do. And when you are doing an audit, you do these assertions that the information that they're using is correct, that you are picking up the full information, that the information that you're using is this period, not next period, that the actual thing exists is not only just made up, etc., etc., etc. Okay, and in one of my former slides, handwritten slides, I talked about bad measurements. And my question is, can you use some of the audit methodology to ascertain that the measurements we're receiving are correct, and maybe to help them to improve? What do you think about this?
Is the question about how to apply audit methodologies to validate the data out there?
My question is
improve.
Is even more than that, is can you? Is not how to. Can you apply this, or is there any value?
I think a good thing is that when we use auditing method, we don't assume that all the information we have are correct. We will try to validate them, use multiple ways, and I think that's very important, because the situation here is that maybe the government do not give us a very accurate number, and maybe due to multiple reasons, we have to find a way to verify the information.
Yeah, I think that's the point that I was trying to make, is look at this particular slide here. What is the population we are dealing with? Maybe the whole world, maybe just the US, maybe just the state of New York or the state of New Jersey. And in auditing, you try to estimate the value of a population. Okay, what are you doing? The basic thing in auditing you're doing, you're saying the numbers that they told me of their sales and their costs are accurate. So basically they picked up the sales, added them all together, and so that's the whole population, and came out with the right number. And how do you do that? You used to do it by sampling and extrapolation. Pick up a 10% sample, add them together and multiply it by 10, or a 1% sample and multiply by 10. And what are the difficulties they have in auditing with that? Is basically that those extrapolation when the sample is very small become very inexact. But I think some thoughts about full population testing or sampling and extrapolation that we've done in auditing are applicable here. Yeah, go ahead.
In Brazil, as we don't have too many tests, we are to test. Not sure it's been efficient, but they are trying to do that here. Some technique to test some cities to see if they have finding some coronavirus. And I think they are just testing on people that have symptoms. I'm not sure how they're doing actually, but I know they are trying to do that because we don't.
Yes, Marcel, that's exactly where I was aiming at, is that maybe we can use some sampling, some geographical selection, maybe some dynamic analysis to make these estimates. I'll give you an example. For some reasons, the entire, I think it was the NBA, the National Basketball Association players were tested, every one of them. And there are about 450 of them. And basically, I think they were kind of wondering if they could restart a season without danger of contamination for the players. So that's kind of a little world, but in that little world, they have pretty much exact information. And they found something like 15 of them carriers. I don't know what was the outcome of that, if they developed symptoms or didn't develop symptoms. I don't know the rest of the story. One thing is true, the NBA and the National and the Baseball League and the NFL wouldn't be on anyway. They all stopped. There is no professional sports going on at this moment. But what is the reason of my example here? Is that there are unusual circumstances whereby you can make a full population test and learn something from it. Now, I put in the right side here, variables. And the variables are geography. And particularly in a pandemic, the variable is very important because the contagion is geographical. It doesn't happen at the same time. It spreads. The second thing was age. The pandemic is really much more virulent for the people that are affected at my age bracket. And the third one, which has just recently become exploited extensively, is that minorities are being tremendously more affected than others. And so these are parameters to be thought about and to be examined. Now, what I said here is that you can find some anomalous measurements that you did for one reason or the other and try to extrapolate to the population. But that's very contingent to where it was. And you know, basketball players are particularly healthy. They are professional athletes and young. So that's not a very good extrapolation. But I know the Chinese made some random population testing and drew some conclusion. And that's what Farid Zacharias was talking about, about contagious from people that didn't have symptoms, non-symptomatic contagion. Okay, now back to the next one of analysis is you can make extrapolations of full population, identify who is healthy, who is not healthy. but that would take a lot of resources. Okay, and then this is actually has not been studied very much, is several categories: infected, not infected, infected but non-symptomatic, non-infected that became infected, infected that got cured. There are all kinds of subpopulations there, and they are like auditing populations that have different characterizations. Okay, now the data of this area here, although not very good, is better than the other data, because there are methods to capture how many people are hospitalized, how many intubed, how many passed away. Okay, each one of these, however, we created subcategories and we created reasons to think the measures are not good.